Okay. So this is really, and I introduced it earlier, this is echoing echo, sharing our knowledge with others. And this is really about how we and how you have used what we've learned, what we've experienced in this echo, and translated that into our work, into the communities in which we practice. And so if we go to the next slide, this is our disclosure statement from our Hub team, and to say that they're listed on the screen, but there's nothing here that folks have any conflicts of interest or anything to disclose as it relates to this content, I should say. And this is a similar slide about financial support, and where the in-kind support is received, and that there's no conflict of interest. This is you've seen these slides before about mitigating potential bias, and the statement around it being evidence-based. So our learning objectives for today. The first one is to identify learnings or concepts that you would like to share with your colleagues, workplace, or community, and we'll start to share, but then we have a lot of time for the floor to be open, and we hope that you can participate with us. The second is to compare and share different strategies for disseminating these. And the third is to develop a plan for your situation and context. And they're so important that we decided to label them all number one for today. So we hope that you'll participate with us in this discussion. And then on to the next slide, I'll start us off. When I was reflecting on some of the things that I'd learned and had participated in this particular echo. I guess I feel like I'm somewhat new to the echo coping with COVID community in comparison to some folks who've been coming since the very beginning. I think I joined sort of halfway in. And the first thing that I appreciated right off the bat was the mindfulness exercise that occurred right at the start. This is something that I guess I'd heard about, but I'd never practiced really, at least not consistently myself. And seeing how you could incorporate it into a meeting or into a session with colleagues, I found to be really helpful. And so something that we've done on my team is when we have team meetings, one of us takes turns. So we've copied how it's done here. And we have someone run a mindfulness exercise. And I think I shared at an earlier Echo Coping with COVID, someone on my team gave me a little book with a number of exercises that we could use for these. So we're not doing the same one over and over again. But Heather, I want to get the one that you just did today, because I like the idea of more moving your body. The second thing I learned from hearing people speak that we've incorporated is really ensuring that we encourage our team members to actually take some time away, and not just about me taking time off, but even though that's obviously quite important, but making the space for others to feel like it's okay to take time off. And particularly, I think about, and I worked in the vaccine clinic with Nitin, often there would be a time when all of a sudden the age categories opened up, and all these additional bookings came in, and we're looking for more vaccinators. As an example, it's easy to put your hand up and say, I really want to do some more shifts in the clinic. And so reflecting on that and knowing that you actually do need some time off in between your clinical work and administrative work and whatever else that you do to recharge. So I think that was a big learning, and we've dedicated time to actually talking about how we're giving people that time away. The next picture on the bottom left for me was, I was trying to find a picture that was like your reality check, which this is the closest I could get for a picture here. And this is about, sometimes in my work, I'm doing a lot of administrative work, and other times, particularly when we had more vaccination appointments, I was doing a little bit more clinical work. And when I'm in my admin role, sometimes I forget what it's like even if it's for a week or two since you've done clinical work, you sort of lose sight of what the realities are and how stressful it can be. And so to be in a clinical role, and so hearing the discussions and hearing people's concerns and sharing for me was really helpful to be like, oh yes, that's what's really going on right now. I'm not sure if this resonates for others. And then the last one was very practical, and that's that photo on the bottom of, it's sort of cut off a little bit, but it's supposed to demonstrate vaccine hesitancy. And so there's some very practical, very specific things that I learned in these sessions that I was able to share with my colleagues and share with patients that I was interacting with, specifically when it came to vaccine hesitancy. Javed, I think you often describe scenarios because you were working at, I don't know if you still are, but at a vaccine clinic, and how you handled specific scenarios. So essentially I copied some of those and shared that with some colleagues too about, okay, this approach might work in having this discussion. And that the same thing is applied when we've had some sessions, say on long COVID, and a number of other very fact specific or more scientifically driven sort of presentations. So I'll stop there. I think all of us took a different approach to thinking about how we might think about this topic and echoing echo. And so you're going to see that. And we encourage you when you get into the discussion section to do the same. So the next slide is, I think, Javed.
Yeah, when it's blue, it's a pretty safe bet. So I'm actually going to echo a bit of what you said. I think that's going to be a theme we'll recognize. There's actually certain strengths of echo, I think, that come through that resonate with all of us so significantly. And the mindfulness was a big one. So a lot of us changed our roles in how we worked through this pandemic in different ways, and took on new jobs even to this process. One of the jobs I took on was as for the Ontario College of Family Doctors, being their provincial primary care lead. And that was about redesigning a lot of their programs for helping my fellow family doctors learn how they would handle issues around mental health, substance use, and chronic pain. And this echo, which started up 2 years ago and as one of the earlier team, really fundamentally changed. I think we learned so much about how differently to connect and support each other as healthcare providers in doing better care, in coping with the stresses of care, and recognizing these are not separate things. So we've talked in this echo, for example, about the clinical issues that Jillian highlighted, but also the need to talk about self-care and your own experience in that moment, just together at the same time, that your act of giving care isn't separate from your act of taking care of yourself or your own validity of experience when you're doing that work. And so we actually definitely learned from this echo, and the program that we built provincially was really informed by what I learned here from all of your conversations, what you shared back, and what was important. So when we have our program is kind of complementary to echo, it actually often we feed in and let people know about echo so they can come here and learn here as well. So growing that community through connections. But we actually have the mindful moment to begin with every single time. And we actually made it more formal. So we have a particular lead who regularly does it. It's for a large webinar, several hundred people who join in each time. And we actually ask in our evaluation, how meaningful and important was that mindful exercise for you? And it's amazing. We have reliably close to 80% every single time, ranking it 4 or 5 at times how much they value that 3 minutes at the start of their morning. We do it early in the morning for our sessions before they start their day. And so I've learned so much from all of it, everybody's conversation experience, how you navigated problems. And I think I really made formal time to reflect back, well, what were we seeing as themes? What's actually important? How am I reacting to what I'm hearing? And then sharing with other people over this. So because of this organic nature and all the different sites we were working at, vaccine clinics, or meeting doctors who have never met before, or nurses and other providers in other hospital settings. And we all started talking about what we learned here, because all of us were being impacted, and there was a chance to even spread this learning in an organic way that just reached further and further over time. And resources were shared further. So whatever you guys had told us about a resource, we have great links that you've given us. These have gone so much further formally as well, not just informally. The other part that I want to share about the connections, I think what we learned here is how well we work together virtually. You can form relationships with people you've never met in real life. And really feel connected and support and learn from each other. And I think it actually is a natural way that we need to support each other. One of the big things that broke, which is this kind of this white elephant in academia and learning in healthcare was this over focus on people local to your institution. This in-personness really favored people who are living in the big cities or near a hospital university. And I think we recognize, well, that's not where the majority of healthcare happens. It's actually out there everywhere in every community, and that's where the most support is needed. And this has normalized the need to actually reach out and connect and learn bidirectionally from everywhere. And I think these are things that this echoes really formalized and talked about how change needs to be understood differently. It's not this top-down pushing information and knowledge. It's about understanding experience and supporting that for everybody together while you learn to do better. But it's not the learning as a primary thing alone. It actually comes as a two-way process from that. So I'll stop there.
Thanks, Javed. And the next slide, I cannot recall who this is we might skip it because there's a few people that were planning to be here, but then had to leave for clinical reasons. So no one's jumping in, so we will pass it to Nitin.
Great, thank you. Yeah, as Jillian had mentioned, we took the echo from different, lenses, different interpretations of what this meant, and to kind of follow on some of the work that Javed just described in terms of the work with the community, the outreach, and the like. I wanted to share some of the work, the experience, the learning that I've had from one of the other echoes that I'm a part of and co-lead of the addiction medicine and psychosocial interventions. And we've been able to actually pivot during COVID and then actually look at just kind of what has been helpful for folks in terms of their learning, their caring for patients with something other than COVID related issues, but something that has been significantly impacted by COVID, just like everything has been. So, what we've done in terms of review over the last while is through a few of the cycles. So we're looking at about 48 sessions of surveys from 600 participants or thereabouts, multidisciplinary. Next slide, please. Okay, what we saw across the board was that folks continue to derive benefit in kind of all the major domains that we tend to track and study in terms of continuing to build skills and knowledge, having learning needs addressed, but both the scores and when we come to this in subsequent slides and talk about this a little bit more is there is tremendous feedback on this platform working to help reduce professional isolation. Something that historically, even pre-pandemic, a lot of the work that we do, and I think this is probably more accurate and fair for those who are working in the community in smaller groups, often not on robust interdisciplinary teams. There is a sense of professional isolation, and I think that through the feedback that we've gotten and just kind of the surveys and I think we see that even here in this echo that a lot of people, and I wouldn't say only Spokes, I think that Spokes, Hubs, everyone, we find that there is just immense value in that the themes of community of practice, having a safe space to learn, to discuss, and themes that what we found here is we actually incorporated a platform to talk about anything related to COVID, and that could mean sharing your few thoughts and feelings when there's a lot of reservation anxiety early on, an opportunity for navigating limited or changed resources and access to care. And here you're struggling with your patient who's struggling, and I think that there were themes of that across the board that was really highly rated and kind of gave us an opportunity to reflect on, ECHO is an opportunity for us to have a community of practice and to share thoughts and feelings, regardless of what the ECHO is. But even in terms of our day-to-day work, I think that there, before our huddle or before our meeting today, Jillian and I were just talking and trying to figure out, are we in the same building? And lo and behold, we're not. But it just goes to show, I mean, we're a building across from each other, but it just goes to show that, in a lot of the work that we do, you don't have that, you don't see people, you don't connect. And I think that, that's something that we need to be mindful of as well, that we need to have connection. So next slide, please. And yeah, in terms of that, kind of big picture, we're all in the work that we do, not everyone. In fact, really only a small number of the people in this ECHO are directly working with COVID patients and managing COVID directly. The reality is we're all healthcare workers, and we're working with humans, whether as patients or as friends and colleagues. And I think that what I've learned, I think that there needs to be a platform to continue to cultivate your skills, interests in whatever other area as well. And it was helpful to know that despite a pandemic, despite concern, there was still an opportunity for folks to learn and cultivate skills in an area outside of COVID. Next slide, please. Okay, and here's some of the open text feedback and that we had from some of our participants, and then I think it just captures the importance of addressing isolation, helping build a community of practice, helping to learn through didactic materials, so you're still continuing to build on your knowledge. And we pivot a little bit with this ECHO specifically, but for those of you who've had experiences with other ECHOs, there generally is a case component that is an integral part of learning. And I think a lot of folks have found that to be helpful for learning, generally speaking, but also to have support around how to help a patient on their roster who's actively struggling in a difficult case. And there's also an opportunity through this community of practice, once again coming back to have access to support and resources that you may not otherwise have. And I think when I look at my experiences with this ECHO, it's actually pretty cool to have an opportunity to reach out to some of my Hub members who are champions in their respective areas when I have tricky questions about how do I support a patient who's maybe having biases or reservations around getting a COVID vaccine, or someone who's like really has a family member who's really unwell. So it's been helpful to just have that support for me, and I think we've gotten that through the feedback from the spoke members and the other ECHO as well. Next slide, please. And another, it's just kind of coming back once again, pandemic disproportionately affecting those with addictions and substance use disorders, and that's what we've seen in terms of feedback in kind of coping and managing these patients from spoke members. It's certainly been given an opportunity to give me food for thought. That's my day-to-day work involves working with people who are disproportionately affected by kind of these conditions. And I've certainly seen an opportunity, a lot of access to care, resources, and things shut down. Me personally, I've had my the inpatient unit that I worked on shut down during the pandemic. So it's been good to realize and reflect that there's that ongoing need for that connection, and also learning on kind of the challenges that everyone's seemingly having. So a lot of folks found that to be helpful. I've been able to kind of capture that through some of the surveys specifically, but also that's helped me be a little bit more mindful in what I bring back to the work that I do with both my patients and the teams that I work with specifically, because everyone's been affected with the feeling stuck at times. So it's it's just been an opportunity for reflection at that front. Next slide, please. Okay, here, just once again, some more numbers in terms of just the value and importance of openness and support, the opportunity for continuing to enhance skills and knowledge and strategies. And I think that that's been, in the addictions realm, during the course of this, we've actually had a couple of changes in terms of what's approved in the ministry. Some of the guidelines have changed in terms of strategies to manage with medication, opioid use disorder. So it's actually been kind of cool to share some of that, despite all the struggles of lost resources and the like. But that's been well received, and the interaction, the isolation, the ability to have consultation, feedback, and case conferencing. A lot of these types of outlets have been things that have been appreciated, well received, and I think that's been an opportunity for good food for thought and for us to think about next steps that we take as we continue to move forward. Okay, next, please. Okay, and so just in summary from what we've learned through this in our reflection was that ECHO in and of itself continues to be effective. We've used the technology of virtual knowledge translation and learning from and with each other pre-pandemic, but it's been cool to continue to be able to do that. But it's also just given the opportunity to reflect and realize that there continue to be the need, and arguably an increased need, for support, distance or otherwise. So that's it. And Jillian, we can turn things over to the next speaker.
Sure, and thank you, Nitin, for sharing essentially the learning and how it another ECHO echoed the work of what occurred and what folks experienced and learned through it. Is it ECHO AMPI? Do you call it AMPI? Yeah. Okay. I was just, one thing that as we're getting into this slide that resonated with me is that similar to ECHO AMPI, I think what's interesting is we formed a community here. At least I've felt that way, and perhaps some of you have felt the same way, in which you can go to others. Earlier this week, I was trying to pick Nitin's brain for an addiction related issue that, that's out of my realm of knowledge. And so had we not had this community here, I wouldn't have known to go to, really. And so I'm not sure if this is your slide, Heather. And if you want to,
this is mine.
Great.
Okay, so I have a couple of slides. I'm going to try and be fairly quick, but this is actually, I was involved in this ECHO from very early on in the pandemic. And this was one of the slides that I showed, and I think one of my very first presentations that I did to the group. And I remember we were very early. If we think about these phases, we were in the preparation, kind of active, heroic phase. This is when everybody was baking bread. Pots and pans were being banged all over the province and the country. We were watching everything that was happening in Italy. It was very early on, and people were very, very stressed and scared, and also high energy. And I remember thinking about, I do a lot of work in physician health and kind of medical trainee health and well-being, and thinking about how are we going to support this community? And everyone was kind of going above and beyond and thinking about how long we would sustain that and how we would try and work at kind of sustaining people's momentum, given that, there was a good chance this was not going to be over quickly. And also kind of longing for this recovery phase. And every time we would come to another week, one of our colleagues who was in this program early on, Mona Lutfi, who's an infectious disease specialist, we would be talking regularly in between the sessions. I know Javid's nodding his head. We used to do this Wednesdays and Fridays. And in between Wednesday and Friday, there would be more information that would come. And Mona kept saying, we have to learn to live with this virus. We have to learn to live with this virus. And we were like, so is it going to be like another month, another 6 months? And feeling like that recovery phase was so far off. And also thinking about, what are we going to learn from this? And what can our healthcare professional community learn to be able to look after ourselves better, and to try and leverage our organizations and institutions to think more about the work we do and how to support us and support our health. So next slide. Is there one more picture of a flower? maybe it, no. Okay, all right. So there was I had a picture of a flower that must have been edited out. It was the one of a pansy that's growing in between two concrete blocks, because I started to really think about and have done a lot more reading and review around post-traumatic growth. I'm a psychiatrist, so I think about that and do that in the work that I do with my clients, but also thinking about that for healthcare professionals as a community and thinking about ways that we can support that. And in the role that I've had, more administratively and educationally with the Faculty of Medicine, I've done a ton of work where I've started to develop and do some teaching around psychological first aid and thinking about it with healthcare professionals and ways that we can integrate this and ways that we really need to be mindful of how we are both human beings and we are professionals. And then when we're working at supporting our peers, we have to remember that we're not clinicians to our peers and we're not clinicians to our learners or the people that we supervise. And I think that that has been something that we've really had to be intentional about navigating and thinking about ways to do that. So that's kind of new work that I'm doing that I've tried to do a lot of to support communities and different teams that I work with, but I will stop there. Thank you.
Thank you, Heather. And we found the
There's
photo,
the
it looks like. We just had it in the wrong order, that's all. But it's a nice photo. So this is where we turn things over to you, everyone here today. Is there anything that you would like to share with your colleagues about how you've echoed ECHO or ECHO coping with COVID? So I really would like to open it up to the floor.